My health insurance costs more than I make in a month. I follow the rules, I pay in, and I'm being told I'm wrong for noticing where my money goes. I was attacked this morning on the internet, and that's when I realized that telling people the truth out loud is sometimes frowned upon. And maybe it was the way that I did it, but I want to explain a couple things. This isn't coming from a Republican or a Democrat. This is coming from a Native American. So I may or may not be against all immigration. I'm just kidding. But I speak from the heart on this, from what I've seen as a medic, as a person, what I've gone through, and what I know. My health insurance costs more than I make in a month. I don't qualify for help, and yet everywhere I look, I see money going out while Americans are told to wait, sacrifice, or stay quiet. This episode is about the cost we are not allowed to add together and what that means for regular Americans. Every immigration argument tries to use one thing to prove a point. One program, one study, one chart, but real life doesn't work like that. Costs don't live in silos, they stack. Healthcare, housing, schools, courts, law enforcement, insurance, infrastructure, fraud, emergency services. No one adds it all together because once you do, the conversations become very uncomfortable. And I realized that today. Budgets are choices. And anybody that knows anything about money knows that. Here's a basic truth people avoid saying out loud. Every dollar spent somewhere is a dollar not spent somewhere else. That's not hatred, that's math. When assistance goes to non citizens, that money does not go to citizens. And when Americans can't afford rent, healthcare, or food, priorities matter. Right now, they didn't ask me any questions. They really didn't. They didn't ask me if I had any money in the bank. They didn't ask me anything. They just told me I was supposed to go back through there and reapply and tell them what I made this month. And then they came back with a higher amount than I was paying because I'm hurt and off work. I'm paying more. Okay. Um, but what I've seen with my own eyes, I've run on the ambulance. I've been in apartment complex where the entire population is refugee housing, everyone on assistance. I've seen houses with 15 to 20 people living inside. When that happens, landlords raise rent because density allows it. Most Americans don't live that way. So rent rises, neighborhoods change, and the people who follow the rules get priced out. I saw this happen in land a long time ago. Healthcare is where it always hits the hardest, and Americans are required to carry health insurance. Many immigrants are not, but emergencies still happen, treated because hospitals can't turn people away. When care isn't paid for, hospitals raise prices, insurers raise premiums. That's not how insurance works. People want to tell me like, no, it is. It is. And that's how my insurance became $1,000 a month. And this isn't a theory. This is how the system works. So we're not even playing with science. And so if people don't understand why, and I'm not going to make this about politics, but I want you to understand a lived experience. When you have people that are trying to make it over the border while they're pregnant, giving childbirth, like to give birth, and helicopters are landing for them. Y'all tell me what you want. Um, they're doing it on the ground. work on a border. Tell me something I don't know. Fraud doesn't have to be everywhere to be expensive. Identity theft, false billing, fake providers, misused credentials. Those losses don't disappear. They get baked into premiums, taxes, and enforcement costs. The people who follow the rules end up paying more, so the system can absorb more abuse. And it's like, I mean, like it's just one of those systems that's going to crack whenever you keep making it like I just don't know where people think it's gonna come from. Labor exploitation, nobody wants to admit. Let's talk about that too, because I've had conversations with these guys and there's a quiet labor problem that no one wants to talk about. One bilingual worker gets paid more to manage an entire crew that works cheaper. Employers save money, immigrants get exploited, American workers get pushed out. And I know it happens. I've watched it and I've seen it. And you tell me it's not happening and you lie, lie, lie. No one is going to win that one. No one. Future costs everyone pretends don't exist, and those are everything else that's adding up. People say they'll pay in later. Well, that's a maybe. But if they become citizens, they will also draw from Social Security and Medicare. Systems already under strain, and you can't keep adding weight to a cracked beam and call it compassion, because where is your compassion for your American citizens? Because I have seen people stacked in beds upon beds upon beds, everybody with a card, whether it's theirs or it's not. Who's going to say? Hopefully we have ID, and if they don't, okay, oh well, who cares? It doesn't matter. Move on. And it's not, don't anybody, don't you ever tell me I'm not the first person there to help another human being, because I am. And I know what it costs to do that. And I promise you, it doesn't cost $60,000 to fly you somewhere. It doesn't. You're eating another bill. And the guy that hit you, we're not going to collect from him either. And when you say, why would I know anything about medical billing? Well, because I've been in medicine for 27 years and I've also been in management. And I know who preaches to us about what, because I know when we're not getting paid. And I know when we need to get paid more. You need to write this, you need to write that person, so y'all can make better wages. So we can make better wages. And these people, these migrants, there's no illegals that are driving up our healthcare. Bullshit. I've had their tuberculosis in my truck and I've been headed north to take them wherever some aunt that's going to go somewhere and going to take them because they're 17 and they're wearing brand new sneakers that my kids didn't have. They've got health care that I don't have. I'm headed right over there. Shine Arapaho, take care of me just fine. America won't. Thank God for all those papers and that federal money. It won't be me. I won't. It was just an accident. But the funny part is, like, I'm not going to do it. I'll pay it. It'll happen. But I'm here and I'm saying something about it because it's disgusting. And all of it is disgusting. And it's not that I don't want to help people. We're not helping people. We're destroying people left and right. And we are putting people in places that they cannot protect themselves. When you have people that can't live here legally, they hide. You bring criminals and they exploit them. Everybody that doesn't have a voice is abused. Let them write your women, because they will. They are. They're their own. And no one cares because no one's going to speak. Man, where does that come from? Who birthed that? Let's talk about the real victims. Let's talk about how to help people. I'm more sorry, that noise is my pug. She's having a good time, obviously not worried about my extent over here. Taz. But I'm just saying, this stuff exists. It's there. Don't tell me it doesn't. I'm a compassionate person. I will help any human being in front of me. I have deployed, I have done strike teams, but I also know why I'm there, and it's because the resources are overran. Who overran them? Why can't we take care of everybody? Maybe we wouldn't have to lock everybody up and destroy everybody's lives during COVID. Have we be able to keep up with the American sick population? All right, so moving on. The real total cost of immigration may never be known, not because it doesn't exist, but because no one is tasked with calculating it. Courts, transport, detention, housing, healthcare, insurance, rent inflation, it's fragmented across agencies. Once Americans see the full ledger, they might ask questions that nobody wants to answer, so let's all hide it. Hence the reason why I don't push either side, because I trust neither. But I do know who attacks me and for what reason. Noting. Uh, this isn't about blaming people. It's about admitting capacity matters. Keeping this country what it should be, a country that cannot afford to care for its own working and its own poor should not pretend it has unlimited resources for others. That's not cruelty, that's triage. And until we're allowed to add it all up, honestly, Americans like me will keep paying more, getting less, and being told to stay quiet. And I won't, because I don't give a fuck. Okay.